Let's imagine that a patient has a cervical disc protrusion. Yeah? And let's imagine it's the posterocentral protrusion. So this pressure takes place through the longitudinal ligament, the posterior longitudinal ligament. And what could be the problem now, if a patient has a very beautiful posterocentral internal derangement and the patient doesn't get mobilization, so we don't reduce the protrusion, the patient gets, let's say, immobilization. What could happen after some time, that thanks to this posterior derangement, you get too much tension in the posterior longitudinal ligament and some periost can be loosened, and of course periost, or the bone grows in the direction of the periost, and then you could get, after some time, you could get two fantastic osteophytes. So those osteophytes are the result of a non-reduced posterocentral disc protrusion. That shouldn't be a big problem. Mostly that's not a problem. But towards the future, that could become a problem, because let's imagine that an osteophyte is growing in the direction of the spinal cord, or an osteophyte is growing in the direction of a nerve root. Then after some time you could get serious compression and serious complications. So what is the moral of the story? If somebody has a posterocentral internal derangement, cervical spine, and if there are no contraindications, we should do our best to reduce this as soon as possible. And then you're going to avoid overstretch of the longitudinal ligament, and you're going to avoid the formation of osteophytes.